Hi parents! Yes, I've changed my introduction to be a bit more inclusive of all breastfeeding and chest feeding parents and people. Welcome to Kindest Milk. I'm Regina Kincaid. I'm an international board certified lactation consultant, mum of 4 breastfed babies and online course creator of Breastfeeding Basics, a practical guide. Here on my channel, I like to share lots of practical breastfeeding tips to make breastfeeding easier. So do subscribe to my channel if you think that my tips can help you. One of my followers over on Instagram recently asked what the reasons for her baby clamping down during breastfeeding may be. Concerns about babies clamping down or biting during breastfeeding often get stronger as babies mature. But many are surprised to hear that a baby can actually not physically bite while actively nursing. In fact, when babies actively suck and swallow, their tongue covers their lower gum and once erupted their teeth, thus protecting the breast. However, biting and clamping down can happen during pauses between active nursing and then can be excruciatingly painful on such a sensitive part of the body. Investigating why your baby clamps or bites can help you decide what to do to stop or avoid this from happening to keep nursing comfortable for both of you. So here are some of the main reasons why babies clamp or bite while breastfeeding. The first thing to check if your baby clamps down or bites is your baby's latch. If your baby's latch is shallow, check out my video on how to improve your baby's latch while at the breast. Or detach your baby and start out the latching process again. Sometimes babies clamp down on the breast when milk flow slows down and they're trying to get another milk ejection. This can be accompanied by a baby pulling off the breast or arching the back. This can occur during periods of growth spurts and cluster feeding when your baby is signaling your body to make more milk. And it usually takes about 2 to 3 days for your milk supply to adjust. In the meantime, switch feeding can help, whereby you switch your baby to the other breast so that baby gets another letdown and another milk ejection. And if baby then displays the same behavior on that side, you switch them back to the first side. So again, they would get another delivery of milk. If your baby is gaining weight appropriately, they're getting enough milk and the clamping should resolve with the increase in milk flow and the increase in milk supply. On the other hand, you may be surprised to hear that clamping down can also happen when milk flow is too fast and baby is overwhelmed by this fast milk ejection and is trying to control the milk flow. And in an attempt to reduce the milk flow, they're clamping down on the breast. So detaching your baby, releasing the vacuum and letting that milk ejection spray into a muslin or a sterile container to save the milk for later use can help. Then after your initial letdown has decreased, you can adopt a laid back feeding position and this can help you overcome this challenge. It is not unusual for older babies to bite or nip when they become distracted by what's going on around them. So feeding your baby in a quiet room with the lights dimmed, perhaps rocking your baby or offering your baby a breastfeeding necklace to play with can help to keep your baby focused on the task at hand. Being one step ahead of your baby and recognizing when active feeding is finished and baby is no longer hungry can help prevent a potential bite. Other times your baby may seek your attention, so be sure to make eye contact every now and then. And last but not least, your baby may bite because she's teething. On average, babies cut their first teeth between 5 and 7 months and their last milk teeth between 20 and 30 months. This is often preceded by teething when baby's gum may be sore and swollen, and they are often more interested in relieving pain than breastfeeding. So what you're really looking to do is managing that teething discomfort. Common ways to manage teething are massaging baby's gums gently with a clean finger, or dipping a clean muslin cloth into some breast milk that you can put in the freezer or freeze, and again rub your baby's gums gently with that muslin cloth. The cool sensation can soothe your baby as well. Avoid anything that can be a choking hazard, and this includes the popular amber necklaces that can be a strangulation risk and a choking hazard. You can also offer a teething toy. You can offer your baby some of the homeopathic remedies of the Teether company, and I leave a link to their products in the description box below. This video, by the way, is not sponsored. You can also discuss infant paracetamol for pain relief with your healthcare provider. As I mentioned earlier, when babies bite while breastfeeding, it can be excruciatingly painful, and I've experienced this myself with my second child, who used to make eye contact even before she decided to nip me in the breast. So the general consensus is, when your babies do that, to take them off the breast. So release the vacuum by putting your little finger in the corner of their mouth and then looking them into the eye and saying gently but firmly, no, this hurts, mommy, and then wait for a couple of minutes before you offer the breast again. And if they decide to do it again, then go through the same process. Repeat no biting with a gentle but firm voice, and detach them, and don't offer the breast again until a couple of minutes later, so that they can learn. And they will learn eventually. I had to express for 24 hours till she finally decided that she did prefer the breast to the bottle, and then from then on she stopped, and we continued on our breastfeeding journey for another few months after that episode. So some babies do have very strong personalities, and they can be very strong-willed, but it is worth applying these measures so that you can continue your breastfeeding journey successfully.